Welcome back to IACI TV. I'm Roy Shepherd, and we're now going to be talking about Europe and the involvement of IACI in Europe. And I've been joined by Stefano del Giacco of the University of Cagliari in Italy. How did I do on all of that?
Oh, excellent.
Okay, fantastic. Right. Stefano, what does the allergology landscape look like in Europe, throughout Europe?
Well, actually, it's a beautiful landscape, but you may know very well that there are many differences between the countries, because the allergology landscape has two phases. The first phase is the one directed to patients. The treatments for patients are almost the same in all over the countries, and so the difference can be the reimbursement for several drugs like biologics or something very expensive in particular. So governments may choose different reimbursement forms. But the real difference between the countries is education. Is in education in allergology, because allergology is a full specialty only in a few countries.
At the moment?
At the moment, yes. IACI is strongly working for unifying the path for future allergies in all the countries. And in countries that traditionally had this specialty, like Italy, in fact, Spain or France, for instance, we have allergists. In some other countries, we have ENT doctors that do allergies, dermatologists that do allergy, which for sure they can also be considered as an adjunct value, but a full specialty in allergy is needed. So IACI is striving to get this advocating with local governments.
All right, so when IACI is advocating with governments, I'm assuming that they're not only talking at a national level, but they're also in Brussels, talking at the EU level as well. So what are those sorts of conversations about?
Yes, there are several degrees of conversation with Brussels. We have an office in Brussels, actually, first of all, so IACI is permanently based in Brussels and advocate every day as its eye on it, it's tuned on it. Then we have different levels, because we have registration level for medicine, for instance, and we interact with EMA, the European Medicine Agency, which is not in Brussels, and now is Amsterdam. Before it was London, unfortunately. And
so that's actually, in all seriousness, this has created a lot of confusion, a lot of uncertainty in light of where the UK sits or doesn't sit within the EU. So can you explain briefly, and I know it's very complicated, but can you explain briefly the effect that Brexit is having on organisations in the field that are based in the UK versus those that are now situated in the EU?
Well, the effect is, first of all, it's a practical effect. I mean, there was a huge, beautiful office in London for the European Medicine Agency.
And how many people were affected?
Like almost 10,000, I think.
Right.
And so they had to relocate to Amsterdam, so all the operation had to stop for some time, which is incredible for such a big, institution. And also,
this is before a decision has been made, so...
Yeah, unfortunately, yes. And now the relocation has almost get to its completion, so hopefully they will start again to work fully, at full power. But this, of course, was creating problems. And then regarding Brussels, of course, we have other level of interactions. So we also have a direct interaction with the European Commission and patient association and so on.
So how open are they to the conversations that you're having? I mean, for example, you have the Ambient Air Directive. Do you have to bang on their door, or do they come to you wanting your advice?
Well, to my experience, I have to happily say that they are really interested in what we say. But of course, this kind of advocacy for such large problems must be made with unified forces. So we usually do this towards association of scientific associations.
So you've been involved with the CDA and the Biomed Alliance initiatives. How are those linked with IACI's work?
Yes. CDA is a European Chronic Disease Alliance, which encompasses several scientific societies for chronic diseases and non-communicable diseases. And of course, altogether, the power is much higher. And the European Union is really happy to interact with us because they really like our inputs, as well as Biomed Alliance is something similar in a way, Biomedical Societies Alliance, which also strives for several interesting, widespread topics
Well,
regarding.
allergy and asthma are two of the main topics. Can you just give us an idea of the sorts of things that you're doing, with the EU?
Well, allergy and asthma, first of all, there is a background problem to me, which is some more sexy diseases, I would say, because allergy for a long time has not been so sexy.
Even though it affects just a huge proportion of or a significant number of people throughout Europe.
Yeah, but
it's not seen as interesting.
No, it's not seen that interesting, even if 1 out of 4 in Europe has an allergy.
It's only 30, 40, 50 million people. It's nothing.
Yes,
yeah.
And so now finally they're starting to understand that the lack in quality of life of the European population, the lack in terms of working days lost, or also in so-called presentialism, which is the opposite of absenteeism, meaning that you are at work, but you're not working because maybe your rhinitis is killing you. So you are there, you're paid for that, but you cannot even type on your computer because your eyes are wet and you're sneezing and so on. So they started to understand this. And of course, for asthma, it's a different issue, but now asthma is rising. Unfortunately, you may know that in the world, more than 300 million people are affected by asthma. And so for sure, this is a big problem also in Europe, in particular in Anglo-Saxon countries. And
you started by talking about the patient perspective. So what sort of work are you doing with the EFA, which is a patient focus group?
Yes. Well, for instance, you can see here the leaflet they prepare. They are super active. They are really super active because they are the one interested in the problem. But we work for them. We live for them. Even the basic immunologist, the basic allergologist is working for patients, and the clinical allergologist even more. So they are our best friends, I would say.
So by working together, the voice gets louder.
Sure, and I have to tell that in some occasions they are more powerful than scientific associations.
Now, isn't that ironic that government will listen to patients more than they'll listen to the professionals who know more?
It can be ironic, but of course they also count on how many people is there. And so they must get consensus in a way. And this is good for us. This is good for us because they want to get the consensus of the people. And then, of course, they listen to them. They listen.
You have another leaflet here as well. Can you tell us what this is about?
Oh, this is something which makes us very proud because this is the EU interest group in allergy and asthma. It's an interest group made by European Commission members. So they express their interest from different countries. They express their interest in the field, and they are part of an informal interest group. So they are. It means that they are really interested in what we do, and they get information from us, and they transfer our information, our request at the European level.
So why do you think IACI is important to leverage all of these different resources at the European level?
Well, I think it's fundamental because we are the largest society in allergy, and for sure our voice, our statements, our guidelines, our documents are widespread used, and for sure we can offer high quality output. And together with patients and with the interest group at the European level, I think that all this joint venture can really help allergies to be much understood at the European level, and maybe also funding and everything can raise.
So you were saying earlier that it's not particularly sexy sometimes, but for members of IACI, they can be pleased to know that a huge amount of work is being done at that highest level to further the professionalism and the reach of everything that the members do.
Yes, I think so. I think so.
Stefano, thank you very much indeed. It's been a
Thanks
pleasure.
so much, Roy.
Okay.
My pleasure.
That's all from Iaki TV for now. We'll be back later.